Apple CEO Tim Cook has said Apple's greatest contribution to mankind will be in its health-related work, but CNBC has found the company is experiencing some growing pains along the way. The health team has faced departures and questions about the scope of the bets it's placing. Our story just went up on CNBC.com. Christina Farr is the reporter. She's live in San Francisco. Chrissy, what essentially is the struggle here? Is it about whether Apple's going to place really, really big, ambitious bets in health, or it's going to be incremental? What have you learned?
Yeah, I mean, in a way, it's sort of this weird struggle for Apple because on the one hand, they could do anything in healthcare, and it's an enormous market, more than $3 trillion. But on the other, they need to focus and they need to be cautious and play it extremely slow because the risk of liability here is huge. So you can see how employees would get trapped in the middle. Some want to get very ambitious, do things like healthcare payments and telemedicine and change healthcare fundamentally. And others want to play it slow and steady. And those competing forces have led to some departures of the company.
Years ago, when Apple was first starting off with the Apple Watch, there was a sense in leadership that they didn't want to get involved in regulated devices because they were afraid that that would slow them down. Then they pushed that mindset aside and went ahead and made the Apple Watch a regulated device. Is that perhaps one of the things at the core of this?
Yeah, it's a great point. When the Apple Watch first launched, a lot of the focus was on sports and it was on fashion. But it didn't take long for the company to realize that it was really the health features that were sticky. And those were the reasons that people were rushing to the store to buy the Apple Watch. So since then, they've been increasingly pushing the line of whether this is simply a wellness tool for people who want to be fit and healthy, or whether it's something that could be more in the medical space. And as they've been rolling out those features, it's forced Apple to start to play differently and think differently. How do you launch a medical feature? Apple's never done that before. How do you communicate with physicians about it and convince them that it's safe for their patients? And that's another thing that's come up internally, is some employees have wanted to, say, change the playbook on Apple and do things differently. Less secrecy, more transparency, and a lot more work to educate doctors that its tools are safe.
Chrissy, how much does this speak specifically to challenges at Apple as it thinks about health and its strategy for health? And how much does it speak to, I guess, tech companies getting involved in this sector more broadly and the fact that there's so much opportunity for disruption, but as we've seen for years now, so many challenges that come with being able to forge ahead on it?
Yeah, that's a great point, because these are problems that I'm seeing across several of the largest technology companies. It is certainly not just Apple that's facing these issues. You see this at Amazon. You see glimmers of this at Google. I recently had a reorg there where they just appointed essentially a CEO of health. And some of the reasons for that were the same that they saw at Apple, is you could do anything. You have so much money and so much budget to spend on R&D. But what do you do in the healthcare space? What makes sense? And having a visionary leader to take charge of those efforts is certainly what a company like Google did and Amazon is doing. And I think we need to see that from Apple as well.